I'm joined by Dr. Peter Collignon, who's joined us before. He's from the Australian National University Medical School. He's an infectious diseases physician. Thanks for speaking to us again, Peter. What more should we know about this disease now that we're getting 2,500 deaths, getting close to 100,000 infections? We must have a clearer picture about the fatality rates, for instance, and how they compare to the flu or to the SARS virus.
Well, so far we've got more information, but there's a lot of information, for instance, basic information like the mortality rate, we still don't have. Now, the reason for that is there's still, particularly in China, where the vast majority of cases have occurred, only the really sick get into hospital. And so people with mild disease would not get tested, and so we don't know how many of those there are. And this is a bit analogous to what happened with swine flu back in 2009, in my view. Originally, when the first reports came out from Mexico, the mortality or death rate was about 6%. But when more data became available, particularly in California and then worldwide, but it took many months to know that, the mortality rate was 100 times or more lower than that, because it was 0.00%, 2%. So 2 in 10,000 people. Now, the mortality rate at the moment for this appears to be about 2%. But even when you look at the Chinese figures, it's not the same in every province. In some province, in Wuhan, for instance, it's higher than it is in other provinces. And so the real thing is we still don't know. We do know that about 20% of people who we identify get very sick and end up, having to be even in ICU. But the majority of people who are identified even now still have mild illness that's no worse than a sort of a bad case of influenza. We still don't know, however, how readily it spreads. If you look what's happened in Australia and elsewhere, we've had limited spread within this country. However, over the last week, what we've seen is spread within the community in Japan, particularly in community associated with a couple of clusters. We now have over 100 cases in Italy that have occurred in the community, and also in Iran, which presumably has less facilities and surveillance that we have in Australia. There's been a number of deaths attributed to this virus, so presumably there is virus circulating there as well. And the other sting to this...
Go on, Peter, sorry.
No, the other sting to this is we believe this is people coughing and spluttering, and maybe our hands are major features in spreading this. But at least in China, there's some evidence that it's in faeces or in rectal material. So if you're in a country with a poor water supply, that may be a factor in spreading it as well.
Yeah, well, it's worrying when we look at how the disease has spread in Japan and Italy. I would have thought the other case that medicos will be looking at very carefully is that cruise ship in Japan, because the cross-infection rates seem to be pretty high there, and you may be able to learn something from that as to how the infection was spread. And the other question I have related to all this, of course, is the incubation period, where there are reports of people identifying with the disease weeks after contact.
Well, I think most of the data suggests the incubation period is what's stated now. The average person has it about 5 days, some people as early as 2 days or even a little bit earlier than that, and then up to 12 days. And that would hold for, I would think, 99.9% of cases. Now, whether there's a few rare cases, we still don't know, and we'll only really know that once we probably have what we call an antibody test available, where we can test large percentage of the population and see how many they've got it, and fit that in also with what's likely incubation periods. So again, we can't be 100% sure that it isn't longer than 2 weeks, but it really does appear for the vast majority of people it's more like 5 to 7 days. And I don't therefore think at the moment we should extend a quarantine period to a month, for instance, because that would even be more socially and economically of hardship to people than the 2 weeks that's happening now, with, I think, currently very little evidence that it'll give us a lot more benefit.
In the meantime, wash your hands, blow your nose, all those standard hygiene reminders.
Yeah, everything you should do every winter with influenza and the cold virus, do even more now. Hands are a major vehicle for spreading this. Keep your social distance, a metre away. If you're sick, don't go to work, don't go to school, don't use public transport. Masks maybe have some extra benefit, probably because it stops us touching our own mouth and nose. But hands are probably a very big vehicle in this, and we need to do all the things we should do every winter and whenever we're around, but do it even more.
Peter, thanks for joining us.